Hello doctors, welcome back to the Medico Tube. Our team has once again brought you the most detailed and accurate deemed university NEET PG 2025 fee structure and closing rank data, prepared without any paid counseling so that every candidate can plan their admission on their own. If you are visiting this channel for the first time, make sure to subscribe so that you receive all the important updates related to NEET PG and SS at the earliest. In this video, we will discuss the fee structure and cutoff for management quota seats in deemed universities across all 44 institutes, along with how to interpret the data for different medical branches. For example, in Githam University, Andhra Pradesh, the tuition fee for radio diagnosis is 38,50,000 and the previous year's closing rank was 28,414. This data includes closing ranks for all branches, along with expected marks corresponding to those ranks for this year, so students can estimate which deemed university they may get and what the tuition fee would be. The tuition fees have been grouped into slabs, up to 25 lakhs, up to 30 lakhs, up to 35 lakhs, up to 40 lakhs, under 45 lakhs, and 50 lakhs or more. For instance, radio diagnosis seats in colleges with fees of 25 lakhs closed under rank 10,000, and dermatology also closed under rank 10,000. In the 30 lakh slab, colleges from Maharashtra, Karnataka, Tamil Nadu, Pondicherry, Gujarat, and Haryana are included, although some deemed universities, such as one in Uttarakhand, do not yet offer PG courses. Generally, deemed universities in Maharashtra and Karnataka are preferred due to better clinical exposure and patient footfall, while a few in Tamil Nadu are also good. However, many in Tamil Nadu and Pondicherry have limited clinical load, weaker academics, and higher fees, often available near cutoff ranks. Students should also consider open state-private colleges if budget is a concern. Managing multiple counseling processes across state and MCC levels can be complex, involving multiple registrations, security deposits, and strategic choice filling. Additionally, joining an average college while waiting for upgradation comes with the risk of penalties if not upgraded, so understanding rules and planning choices carefully is essential for securing the best possible seat. Let's go branch-wise. For radio diagnosis, with a tuition fee up to Rs 25 lakhs, the last year closing rank was 7,443 at marks between 570 and 575, up to Rs 30 lakhs. The rank was 15,013 with marks between 545 and 550, up to Rs 35 lakhs. The rank was 20,394 with marks between 525 and 530. Up to Rs 40 lakhs, the rank was 35,551 with marks between 475 and 480, and for Rs 50 lakhs plus, the rank was 65,104 with marks between 400 and 405. For general medicine, up to Rs 25 lakhs, the rank was 13,153 with marks between 550 and 555, up to Rs 30 lakhs, 21,634 with marks between 515 and 520, up to Rs 35 lakhs, 46,848 with marks between 445 and 450, up to Rs 40 lakhs, 52,048 with marks between 430 and 435, up to Rs 45 lakhs, 65,793 with marks between 395 and 400, and Rs 50 lakhs plus, 66,340 with marks between 390 and 395. For dermatology, up to Rs 25 lakhs, the rank was 9,055 with marks between 565 and 570, up to Rs 30 lakhs, 25,006 with marks between 505 and 510, up to Rs 35 lakhs, 31,027 with marks between 485 and 490, up to Rs 40 lakhs, 33,442 with marks between 480 and 485, up to Rs 45 lakhs, 48,023 with marks between 445 and 450, and Rs 50 lakhs plus, 78,100 with marks between 360 and 365. For OBG, up to Rs 25 lakhs, the rank was 30,616 with marks between 490 and 495, up to Rs 30 lakhs, 50,662 with marks between 435 and 440, up to Rs 35 lakhs, 50,662 again with marks between 435 and 440, up to Rs 40 lakhs, 65,083 with marks between 400 and 405, up to Rs 45 lakhs, 70,696 with marks between 385 and 390, and Rs 50 lakhs plus, 94,140 with marks between 320 and 325. For Orthopedics, up to Rs 25 lakhs, the rank was 29,580 with marks between 495 and 500, up to Rs 30 lakhs, 46,582 with marks between 450 and 455, up to Rs 35 lakhs, 75,567 with marks between 370 and 375, up to Rs 40 lakhs, 80,000. 533 with marks between 360 and 365, up to Rs 45 lakhs, 97,025 with marks between 310 and 315, and Rs 50 lakhs plus, 1,11,204 with marks between 290 and 295. For ENT, up to Rs 25 lakhs, the rank was 60,888 with marks between 405 and 410, up to Rs 30 lakhs, 89,633 with marks between 335 and 340, up to Rs 35 lakhs, 94,541 with marks between 320 and 325, and up to Rs 40 lakhs or 45 lakhs. 97,285 with marks between 310 and 315. For TBRD, up to Rs 25 lakhs, the rank was 35,986 with marks between 475 and 480, up to Rs 30 lakhs, 59,261 with marks between 410 and 415, up to Rs 35 lakhs, 77,506 with marks between 365 and 370, up to Rs 40 lakhs, 79,422 with marks between 360 and 365, up to Rs 45 lakhs, 81,501 with marks between 355 and 360, and Rs 50 lakhs plus, 88,769 with marks between 335 and 340. For general surgery, up to Rs 25 lakhs, the rank was 34,186 with marks between 480 and 485, up to Rs 30 lakhs, 60,851 with marks between 435 and 440, up to Rs 35 lakhs, 74,417 with marks between 375 and 380, up to Rs 40 lakhs, 98,978 with marks between 305 and 310, up to Rs 45 lakhs, 1,02,770 with marks between 300 and 305, and Rs 50 lakhs plus, 1,04,897 with marks between 295 and 300. For psychiatry, up to Rs 25 lakhs, the rank was 65,977 with marks between 395 and 400, up to Rs 30 lakhs, 99,088 with marks between 305 and 310, and up to Rs 35 lakhs, 1,03,183 with marks between 295 and 300. For pathology, up to Rs 25 lakhs, the rank was 1,38,546 with marks between 265 and 270. For anesthesiology, up to Rs 25 lakhs, the rank was 93,134 with marks between 320 and 325, up to Rs 30 lakhs, 1,02,941 with marks between 300 and 305, and up to Rs 35 lakhs, 1,05,476 with marks between 290 and 295. For pediatrics, up to Rs 25 lakhs, the rank was 28,005 with marks between 500 and 505, up to Rs 30 lakhs, 31,020 with marks between 490 and 495, up to Rs 35 lakhs, 47,353 with marks between 445 and 450, up to Rs 40 lakhs, 68,498 with marks between 390 and 395, up to Rs 45 lakhs, 68,498 again with marks between 390 and 395, and Rs 50 lakhs plus, 75,269 with marks between 370 and 375. For ophthalmology, up to Rs 25 lakhs, the rank was 54,040 with marks between 425 and 430, up to Rs 30 lakhs, 82,083 with marks between 355 and 360, up to Rs 35 lakhs, 94,688 with marks between 320 and 325, and up to Rs 40 lakhs or 45 lakhs, 94,688 again with marks between 320 and 325. Before selecting any deemed university, candidates must check the clinical exposure, patient footfall, academic quality, and return on investment, as not all deemed colleges offer the same opportunities. This entire dataset cannot be explained in a single video, so you are advised to take a screenshot for reference. See you in the next video. Till then, take care and keep watching the MedicoTube.